Good afternoon. It's 1:02 p.m. Will the Committee on Energy, Environment, and Sustainability please come to order? I'd like to welcome Committee Vice Chair Dos Santos Tam, Councilmembers Tupola and Toba to the chamber as well. Pursuant to Section 92-3.7 Hawaii Revised Statutes, this meeting will be conducted as a remote meeting by interactive conference technology with the following procedures in effect for the meeting. Members of the public will be allowed to provide oral testimony on all items on the agenda in two ways, remotely and in person in the council chamber. Remote and in-person oral testimony will be allowed when the agenda item is taken up, as both English and Hawaiian are official languages of the state of Hawaii, pursuant to Article 15, Section 4 of the state constitution and Section 1-13 of the Hawaii Revised Statutes. Members of the public may testify in either language. For oral testimonies offered in Olelo, Hawaii, additional time may be necessary will be allowed for the testifier to provide an English translation of their testimony if they so wish. Before testifying, each person shall state their name. Each speaker may not have anyone else read their statement and is limited to a 1-minute presentation on each item. All persons who have registered to testify remotely by video conference or phone will be called upon first. When your name is called, please monitor your screen and activate your audio feed when prompted. I will then give persons who have not registered an opportunity to offer testimony. Please utilize the raise hand feature in Zoom to be called upon. For those who are joining us by telephone only, press *9 to indicate your desire to speak. I will identify you by the last 3 digits of your phone number. When your phone number is called, press *6 to unmute yourself when prompted. Some friendly reminders and tips. Video conference from a quiet location if possible. If you're also watching the proceedings on Olelo, please mute your television at the time you're called to testify. When the timer on the screen reaches 0, please conclude your remarks promptly. Once all the remote testifiers have testified, I'll proceed to in-person testimony in the council chamber. Persons who have not registered will be given an opportunity to speak following the oral testimonies of the registered speakers. HRS Section 92-3.7 requires all votes at the remote meeting be conducted by a roll call unless unanimous. Therefore, I'll call for objections, and if there are any, I'll call for a roll call vote, though I believe today we're just doing the informational briefing. For those council members participating from outside of the council chamber, which we don't have at the moment, in accordance with HR Section 92-3.7, if folks join, the meeting will automatically recess if we lose audiovisual contact with you and cannot reconvene until we reestablish contact. Therefore, I ask that anyone announce beforehand if they're going to voluntarily sign out of the meeting. Written testimonies, including the testifier's address, email address, and phone number, will be available to the public as described on the posted agenda. As a courtesy, we just ask that everyone turns off their cell phone, and we'll move to agenda item number 1, our informational briefing for the day regarding food access, presentation by the Department of Community Service, Elderly Affairs Division, LANAKILA Pacific, and YMCA. We have everyone here today. I do also see Director Krupke here as well. So I'll defer to you if you or Administrator Ariyoshi want to come up and start the presentation and discussion.
Thank you, Chair, committee members. During this fall was a very difficult time in terms of getting meals out to the public in general, and we had a lot of concerns about our elderly Kapuna population, and especially with the things that went on with the federal government and such. And I think what you'll see today is how we pivot during those times and be able to provide things for our Kapuna. So I have our administrator for Elderly Affairs Division, Derek Ariyoshi, and members of LANAKILA and YMCA here to present the programs that they did this fall. Thank you.
Mahalo, Director, we'll turn it over to them. Just want to know, we did have a discussion at the last committee meeting with partners just about the status of food security in our community, and so we're grateful for all the partners here today to kind of dive into some of the ways the city and also other counties may be working in this area. So I'll turn it over to you, Administrator. Mahalo for being here.
Thank you. So aloha and Happy New Year, Committee Chair Wire and honorable council members. My name is Derek Ariyoshi, Administrator of the Department of Community Services Elderly Affairs Division. I have the unique pleasure and joined by our provider partners, Leanne Landreth with the YMCA of Honolulu and Melissa Gibo and Lori Lau from LANAKILA Pacific. It is said that a village without kupuna is like a well without water. And for that, thank you for the opportunity to be here this afternoon and speak to the topic that is kupuna food access, what the needs look like, how our programs are impacting our community, and where opportunities lie ahead for all of us. This presentation is organized largely around three goals. First, to provide community context on the food and nutrition needs of kupuna on Oahu. Second, to explain how existing meal programs support health, independence, and the opportunity for our kupuna to age in place, thus preventing or delaying institutional care, for example, nursing home placement. Third, to share system and community level observations, boots on the ground, if you will, that impact kupuna access for older adults. Research consistently shows that food security is closely tied to health, independence, and overall quality of life for our older adults. This information is not new to all of you. Many kupuna are already managing chronic health conditions, and inadequate access to nutritious food can worsen these conditions, often leading to more intensive and equally important costly medical care. Hawaii's high cost of living forces many of our kupuna to make difficult trade-offs between food, housing, and medical care. Nutrition programs help ease these pressures and serve as a critical preventive support that helps kupuna remain healthy and, equally important, independent. On Oahu, kupuna make up close to a quarter of our total population. 43% struggle to make ends meet. 19% live alone. 36% have some form of disability, and 28% speak a language other than English. And that's the two-sided coin, right, of our diverse kupuna population, right? There's so much beauty in all the rainbows that make up of who our kupuna represent, but with that diversity comes a lot of different layered challenges as well. As I shared already, many kupuna lived on fixed income, Social Security mainly, lucky if they have a source of pension, leaving little flexibility to absorb rising food, housing, and medical costs. Even the smallest disruptions can significantly impact food security. Transportation barriers and geographic isolation further strain access, particularly for those kupuna who live alone. Recent SNAP policy changes, as Director Kraki mentioned, and government shutdowns have really exposed, and I'm sure you folks see it in your own communities, have exposed vulnerabilities in the broader food system, increasing dependence on community-based nutrition programs, whether it be the Hawaii Food Bank or some of the programs that we administer with our community partners. During these moments of strain, whether natural disasters, public health emergencies, or policy disruptions, EAD continues to play a critical role as system strategists, conveners, service implementers. Our work during the COVID-19 pandemic to lead strategies to support food and vaccine access, and most recently, our help to expand meal distribution for our kupuna SNAP participants impacted by the federal government shutdown. These examples demonstrate, and I see this as a positive, demonstrate the resilience of our community and our service networks, but also growing demand placed upon all of us. EAD administers two primary nutrition programs, home-delivered meals and congregate dining meals. I'm confident that we have representation in all of your council districts. Both programs support, foster social connection and help, again, to hit the point to the opportunity for kupuna to age in place, though each of those programs are tailored to a specific population, which we'll talk about. Home-delivered meals is designed to help kupuna remain safely in their homes and avoid institutional care. Similar but different, congregate dining focuses on keeping kupuna active, engaged, and connected within their community. Home delivered meals keeps our kupuna in the home. Congregate dining programs keep kupuna active and engaged in the community. Similar but different. Now, home delivered meals specifically are targeted to serve the most vulnerable and frailest of our kupuna. Eligibility criteria for participants established by our state funding are very strict. Participant must be deemed as homebound and unable to perform 2 or more activities of daily living. So when I say activities of daily living, I mean things like walking, bathing, dressing, eating, toileting. Home delivered meal services goes beyond providing food. It also creates social connections between our kupuna and the staff and volunteers who deliver their meals. And that's a testament to our providers here today. For some, these visits provide a critical second set of eyes for our kupuna, and in some cases, the only point of human contact for those that live alone. The only human contact for those that live alone. Over the past year, our home delivered meals program served 614 kupuna, delivering close to 138,000 meals, supported by 1.6 million in combined state and federal funds. These numbers not only show the scale, but the intensity of the type of services required to support our most vulnerable kupuna so that they can remain safe, healthy, and living in their own homes again. Now, complementing our home delivered meal programs, congregate dining provides nutritious meals in a shared community-based setting. In addition to addressing food security, congregate sites intentionally integrates health and social engagement activities that go along with our meals. So think about the impact of sharing a meal, not only for nourishment of the body, but nourishment of the soul. Social and community connections, we know this now, is a fundamental human need, no different than water, food, shelter. And this became all the more real during the pandemic. We saw how social isolation impacted both the psychological, the physical, and the spiritual well-being of our kupuna in very tangible and real ways. Our senior helpline staff during that time, we've heard and seen really compelling and heartfelt stories of how kupuna struggled for all those reasons because of isolation. We now know the importance of being connected to other people and communities. Now, who are our congregate meal participants? Many congregate participants, yes, as intended, are able-bodied, but have significant economic and social risk factors. 38% live in poverty. Close to a third live alone. Over 1/3 are age 80 years or older, and nearly half of participants have been assessed as high nutritional risk. During the past year, 736 kupuna were served, providing over 52,000 meals, supported by $1.2 million in federal funding. Now, we proudly administer 10 congregate meal sites. And this mapping reflects a couple of points. The blue dots reflect kupuna housing. The purple dots reflect existing congregate meal sites. And these locations are essential for delivering accessible, complete, nutritious meals to our community. As you can see, many of the meal sites operate near senior housing intentionally. Congregate meal sites serve more than just food. They function as engagement hubs. The sites and the intentional programs being administered out of it serves to connect kupuna with the community. They are one in the same. While this service network is valuable, equitable access remains still challenging. And you can see that in the map, particularly in rural areas of our island, as federal funding provisions require meal sites to be operational 5 days a week, with certain exceptions, 3 days a week. So let's speak to some of the limitation factors. I shared some of them already. Home delivered meals are only limited to those that meet strict eligibility criteria to state kupuna care eligibility. Again, we stated homebound, 2 or more activities of daily living, leaving some food insecure kupuna without access. The determination for homebound is pretty black and white in our assessment tool as mandated by the state. I would say one example would be, as we have some kupuna that technically wouldn't be considered homebound in outlying areas, rural areas, if you will, where maybe mobility and maybe limited transportation or limited formal family support, the lack of it doesn't necessarily keep them homebound per se, but it makes traveling or accessing services programs, including food, outside of their immediate vicinity, very problematic. So that's one question on the policy to community needs side that could be explored. Now, related to barriers or limitations for our congregate meal sites, federal funding policy, as I said, requires those sites be in operation 5 days a week, some limited exceptions 3 days a week. But as we are engaging the community and community partners, and we all know this, council knows this, we have amazing community partners out there, whether it be Waimanalo, Hauula, Kaneohe, North Shore, that are doing impactful programming. But because of their areas, possibly because of the limitations in physical infrastructure or staffing infrastructure, really isn't possible for them to be in operation 5 days a week. There may be an opportunity or maybe shared opinion that 1 day a week with robust and intentional touch points and programs and supports, 1 day is better than no day. So I think these are the opportunities we should consider and explore. Now, a few takeaways as I transition over to the real boots on the ground folks. Food insecurity among kupuna is legitimately a growing concern. And it's highlighted by the realization that by 2040, approximately one third of our total population will be kupuna. 1/3 of our total population will be kupuna. Existing nutrition programs are essential and they're effective, and we know that, targeting those with the highest needs. At the same time, program structure, funding, and policies do influence who, where, and how kupuna are served. Understanding these dynamics help guide discussions, past, present, future, related to program flexibilities, access strategies, and overall systems improvement. So I have the pleasure now of working alongside and truly being inspired by the incredible community partner organizations, some of which you will hear shortly, and the amazing individuals who make them thrive. Our communities are better because of them. Their insights help bring these programs to life, showing how they operate on the ground and highlighting both the challenges and opportunity, because that's the spirit and lens which we operate in the aging network, in meeting the needs of our older adults. So at this time, I would like to hand it off to Leanne Landreth with the YMCA. And I think after their presentations, happy to answer any questions you may have.
Well, Mahalo.
Aloha. Thanks for having me today. My name is Leanne Landreth, and I serve as the Vice President of Membership and Healthy Living for the YMCA of Honolulu. I'm here on behalf of the YMCA and our fellow congregate dining partners to share the impact and the growing urgency of kupuna nutrition and wellness programs, including the WISE Congregate Dining Program, which we call YMCA Kupuna Funa Fun. As you consider issues of sustainability, resilience, and community well-being, I want to offer this perspective. Food security for kupuna is a sustainability issue. In Hawaii, kupuna are not simply seniors. They are the keepers of culture, wisdom, and connection. Yet far too many are struggling with the rising cost of living, food insecurity, chronic disease, and perhaps most quietly and painfully, social isolation. Congregate dining programs exist because a meal alone is not enough. At the Y, our Kupuna Food and Fun program brings kupuna together to share nutritious, culturally appropriate meals, participate in movement and enrichment activities, and most importantly, to connect with one another. For many participants, this program is the primary reason they leave their home that day. I want to tell you about one of those kupuna. Her name is Joanne, and she participates in our Kupuna Food and Fun program at our Kaimuki location. Joanne shared that she has dealt with depression and anxiety for most of her adult life. And during the pandemic, that isolation deepened. She wrote to us, "Things got really tough. I felt lonely and isolated." And when she later began dealing with health challenges, leaving home became even harder. And this is where the Kupuna Food and Fun program became a lifeline. Joanne further wrote to us, "I am much happier and healthier now thanks to the Kupuna Dining Program. Being with the other kupuna has really helped. I feel loved, cared for, and supported." So she didn't just receive a meal, she found her community. She told us that the meals are delicious, well-balanced, and nutritious, and that the protein she receives through the program directly supports her health. Just as importantly, she shared that the free meals help ease her food expenses, which, as Derek shared, is a growing concern for many kupuna living on fixed incomes. And she said, "One of my favorite benefits has been the friends I have made." And this is the difference between food access and food security. The Y is one of many congregate dining sites supported through the City and County Elderly Affairs Division. Programs like ours show how community partners and organizations with shared purpose can come together to improve food security, expand access, and strengthen community health, all at the same time. Through partnerships with collaborative organizations like Hawaii Meals on Wheels and LANAKILA Pacific, meals are prepared safely and delivered reliably and with care to congregate dining sites. These partnerships allow organizations like the Y to do what we do best: create spaces of belonging, movement, education, and joy that support whole person health. In her letter to us, Joanne described gardening together on Mondays, bingo and games on Fridays, live music, exercise classes that keep her healthy and moving independently, educational speakers and seminars on topics like health, safety, digital literacy, and fall prevention. Joanne represents countless impact stories that we hear from our kupuna every day at the YMCA. Another kupuna wrote to us, "As it's very difficult for me to prepare my own meals, Kapuna program at the Y means I at least get a healthy, balanced meal several times a week. I depend on these meals to eat well. Another Kapuna participant at our Waipahu location wrote to us, I usually eat alone and do most things alone because I live in a foster care home. Through this program, Kapuna like me gather to eat, and I've made all of my good friends here. Thank you so much. I am not alone anymore. And yet another Kapuna at our Mililani location wrote, without the Kapuna program, I would have nowhere to go. In this program, I have a closeness to everyone. I have another place that feels like home. It fulfills a gap in my life where I have had losses. That's the Kapuna Food and Fun program. This is sustainability at the human level. The impact of this model is both human and measurable. Since our partnership with the City and County Elderly Affairs Division started in January 2022, the Y's Kapuna Food and Fun program has served over 210 nutritious meals, provided more than 11,000 hours of wellness and enrichment activities for Kapuna, operated at 6 locations across Oahu, including the Waianae Coast, and supported over 2,100 unduplicated Kapuna, serving approximately 575 Kapuna every year. And our outcomes tell a powerful story as well. Of our Kapuna Food and Fun participants, 97% reported having more energy. 95% felt stronger. 99% made new friends. And 96% reported a more positive outlook on life. These are not soft outcomes. These are preventative outcomes, outcomes that reduce hospitalizations, delay institutional care, support aging in place, and strengthen community resilience. And this is what sustainable food systems look like at the community level. Systems that nourish not just bodies, but people and place. However, I also need to be very clear about the challenge before us. Today, we serve hundreds of Kapuna each day, and we maintain a wait list. Not because we lack the space or the staff or the partnerships, but because we lack sustained funding. Currently, Kapuna Food and Fun is supported through 2 streams, the City and County Elderly Affairs Division, and for the past 2 years, short-term funding that the Y has worked hard to secure, first through a 1-year federal earmark from Senator Hirono, then a private foundation gift, and most recently, State Act 310 funding. But as you may know, Act 310 funding expires at the end of 2026, and without a long-term solution, we will face another funding cliff at the very moment when demand is accelerating. I want to share one more Kapuna Food and Fun participant testimony with you. She said, I lost my husband during the pandemic and felt so alone. This program gave me more than food. It gave me friends, laughter, and the strength to keep going. As Derek shared, by 2040, nearly 1 in 3 Hawaii residents will be over the age of 60. The question is not whether we choose to invest in proven, preventable solutions now. It already has become a great need in our community, and we are ready. The congregate dining and health promotion community is ready, poised. We have the infrastructure, we have the programs, we have the trusted community partnerships together, and we have the ability to collaborate and anchor our local communities. And we also have decades of experience serving Kupuna with dignity and aloha. So I hope you're asking at this point, what can I do to support? What we need now is your partnership, your advocacy. At this point where sustainability, health, food systems, and aging intersect, we respectfully ask that when the time is right, you will help us advocate for state support for sustained, reliable funding for kupuna, congregate dining, and wellness programs. Funding that allows us not just to serve the current need, but to grow strategically and meet the true scale of need. Monies that allow us broad enough flexibility to plan responsibly and also to serve our communities in a nimble way that meets the current need today. This is not just an investment in meals, it is an investment in connection, in prevention, in whole health, and in honoring the kupuna who have given so much to Hawaii. Thank you, mahalo for your leadership, for your commitment to sustainability, and for your care for our kupuna. We look forward to continuing this partnership and building a future where every kupuna has the nourishment, the connection, and the support they deserve. At this time, I'd like to pass it over to our partners at LANAKILA Pacific.
Mahalo.
Hi, good afternoon. Chair Wire, members of the committee, thank you so much for having us and allowing us time to speak today. My name is Melissa Gibo. I am the Vice President of Programs at LANAKILA Pacific. So LANAKILA Pacific is actually celebrating our 87th year anniversary this year, and our Meals on Wheels program is celebrating its 55th. So we have been in operation and in this business food programs for quite a while. LANAKILA Pacific's mission is to build independence and improve quality of life for individuals with cognitive, physical, social, or age-related challenges. And so we offer a diverse range of programs that serve both older adults and individuals with disabilities. But really one of our core programs is our LANAKILA Pacific Meals on Wheels program. And we are committed to ensuring that kupuna in our communities do not go hungry or live in isolation. And I know I'm echoing a lot of the sentiments of EAD and the YMCA, but I wanted to make sure that we were providing a larger provider perspective on what we see as the system insights about the kupuna food access and our food service systems. As the largest and only island-wide provider of home-delivered meal services for kupuna and individuals with disabilities, our meals go far beyond addressing food insecurity. You've heard a lot about what it's doing to address social isolation, but really through balanced nutrition, we are improving health through our program models to provide both social connections and build community. So in the numbers that Director Ariyoshi provided, you could see the scope of what the city and county of Honolulu is already doing. Our programs through LANAKILA Pacific Meals on Wheels, similar to the YMCA, has had to diversify funding to meet the needs in our community. So although EAD is serving 614 individuals through home delivery and 736 through congregate meal programs, we are serving 1,500 through our program alone, unique individuals, when you also factor in the individuals who are also supported by Medicaid or other funding services, including private pay. So Medicaid currently covers about 70% of our home delivered meal recipients. So of the vast majority of the seniors who are receiving meals, they are largely low income, based on Medicaid eligibility requirements. So as Director Ariyoshi also stated, the amount of seniors living in poverty who are reliant on these food services is much larger than the scope of what the city can address through its own programs. In the last year, in just calendar year 2025, LANAKILA Pacific provided 308,744 meals to seniors in our community on the island of Oahu alone. So of those meals, close to 100,000 were provided through city and county elderly affairs funding. And when you look at the food as a health intervention, you start to see more than, or a bigger picture in addition to what Leanne from the YMCA was able to talk to, The congregate model, as both Dr. Ariyoshi and Leanne spoke to, is really addressing the needs of younger active kupuna. It's very preventive. It is a very effective health intervention strategies, but it meets a portion of the needs of our aging community. And Hawaii has some of the oldest old seniors in our nation. And so when you think about how we use city and county monies or state funds, we are trying to be as creative as possible and utilizing as many flexibilities as possible to be able to meet senior needs and meet seniors where they're at so they can effectively age in place. When we look at some of the programming that we are able to put into place through Elderly Affairs Division, we created a virtual congregate dining model. So in addition to home delivered meal services, we know that many of our seniors are providing in-home care for loved ones. The value of caregiver support is tremendous in our state. And the virtual congregate models allow for people who are unable to leave their homes due to caregiving responsibilities or other barriers to transportation that Director Ariyoshi spoke to. It allows them to have different mechanisms to address social isolation, and the flexibilities through unique programming allows us to meet some of these gap areas. And so I provided some information, hopefully you folks have it in front of you. And when you look at the aging trends of our programs, you can see that the youngest of the kupuna are as active as they possibly can in attending the congregate dining programs. As they start to get older, they take more advantage of some of the virtual options, but virtual options also become a critical support force for people who are homebound and don't have any other options for interaction, where primarily right now they're getting them through home delivered volunteers. And where you see the highest level of home delivery meal recipients are really our most frail, most vulnerable, the people 50% over the people who are receiving home delivery services through the city and county are over the age of 85. So it is quite a large number. And because of the age breakdown and being able to see how Medicaid supports this on the other end of that, you can see that we also serve people who don't meet the age criteria and who are under 60, but face similar challenges due to disability conditions. So it's just a larger framing of the issues that are facing our programs. And I'm going to invite our Meals on Wheels Program Director, Lori Lau, to share a little bit more.
Thank you, Council, for letting us share. I'm responsible for the backside of our handout. And so picking up where Melissa left off, right, another thing that we're able to support is through our volunteer opportunities, seniors that are physically fit and more financially stable. We, through our home delivered meals program, use over 215 regular volunteers each week to be able to pack and deliver the meals. In post-retirement for these seniors, it really gives them a sense of purpose. It gives them a new community to be a part of. And as was shared earlier, it helps build community. For these retirees kind of looking for something to be able to do, it connects them with our homebound kupuna who don't have anyone to talk to or spend the day with. When we talk about future opportunities, we really see ourselves as being emergency responders. In preparing for this, we thought about some of the big impacts that have affected our state. Things like COVID, where, if you'll recall, we said in the beginning that seniors were the most vulnerable, right? There were stay-at-home orders that people shouldn't leave their house. And so during that COVID period, we started providing emergency meals to over 1,200 seniors in order to support them in being able to stay home and be safe. In things like natural disasters, before every hurricane season, we make sure we are ready to go should we actually be impacted during the season, to be able to activate quickly, be able to put meals out to communities affected, being able to support first responders who are going to be called on to respond to the hurricanes. Even more recently, like the government shutdown, there were so many seniors impacted because of the effects of their SNAP benefits. So being able to mobilize quickly and being able to provide additional emergency meals to bridge the gap until their SNAP funds were restored. We need support to be able to do that, right? We need plans and policies and funding to be ready in advance so that we can be nimble and we can respond quickly when the time is needed. In our day-to-day operations, there are lots of things we would like to continue to do. And with the help of EAD, we've been able to be really flexible in some of the programming we've provided. You've heard about our virtual model, right? So think about virtual meetings, the kids that were going to school online. It was with EAD support that we were able to transition to virtual programming, as was shared, to be able to support seniors that either don't have the transportation or the ability or time to attend in person. It was with EAD support that we were able to create digital literacy classes, because seniors are not necessarily known as being the most tech savvy. So how did we pull off a virtual model? We had to be flexible and nimble and create new support systems to be able to allow them to do this. With the virtual model, right, it's already been shared, it also is a way for folks who are isolated and not able to connect to be able to be a part of a community and to get all of the same benefits that they would get in person. They do exercise classes, they play games, they go on virtual field trips to the Louvre and to the pyramids, and it is a way for them to be a part of a group even when they're not able to leave the home on their own. We also think about the future, new opportunities to expand our offerings. We talked about how food is so impactful, about how food is actually a form of medicine, right? When we think about chronic illnesses, we know what they are, things like heart disease, kidney disease, diabetes, high blood pressure, right? These are food-related chronic illnesses. And so enabling people to have access to healthy and nutritious food, you actually improve their health and you improve the quality of their lives. But it's more than just having access to the healthy food. They also have to want to eat it, right? And so having more flexibility in the way that we are able to provide that food, whether it be through food boxes, whether it be through more fresh produce, whether it be through meal kits, right? It allows for people to have food in different ways that are appealing to them. It really addresses some of the concerns about like the cultural diversity, right? People that are used to eating a certain type of food, a certain type of flavoring, right? It allows for a lot more dynamic programming, which will allow for more people to be able to get the benefits of it. We wanted to end with some of the stories of the people that we serve. So the beautiful woman on the right side of the page, that is Sharon. Sharon has had strokes and hospitalizations in the last 2 years. These have left her with cognitive impairments. It has left her with speech impairments. Her aphasia leaves her in a place where her family has a very difficult time understanding what she's trying to communicate. She has mobility issues. She uses a walker to get around inside of her house, but she can't leave her home unless she is in a wheelchair. Her husband, Timothy, is a little bit better off, but he is also unsteady and has a history of falls. They also have, unfortunately, a daughter that has also had her own health issues, which has left her disabled. And so care for 3 family members has fallen to their son, and he is overwhelmed. He is trying to handle all of the finances. He's trying to handle all of the household chores. He's trying to make sure that they all get to their health appointments. And so a service like our home delivered meals program is a lifeline to him. It's what is allowing him to be able to keep his loved ones at home, and to be able to take care of them and know with confidence that they have something healthy and nutritious to eat. The gentleman, our smiling kupuna on the left, that is Daniel. Daniel never married. He doesn't have any children. He lives alone. Daniel is very fortunate that he does have some good friends that are willing to come in and care for him. One of his friends comes in and handles all of his appointments, handles his finances. He has another friend that will help do errands like buy the toilet paper and the shampoo and toothpaste. He owns his own home, but because he is wheelchair bound, because he has he does not have use of his right arm, he isn't able to do most things on of his own. He can't get out of bed on his own. He can't get out of a chair on his own. And so he has taken out a line of credit and he has exhausted his IRA to be able to pay for caregivers to come in to care for him. He's paying for caregivers to come in 7 days a week from 7 a.m. to 7 p.m. And when they put him to bed at 7 p.m., he has to stay there all night long until somebody comes in the morning to be able to help him get out of bed. And so for Daniel, our home delivered meals, again, are a way of helping him to have something healthy and nutritious to eat, to make sure that he is cared for, right? He has goals of trying to get more of his physical strength back so that he could even just be able to get out of bed on his own, right? And be able to reduce some of the caregiving time that he's paying for. The last thing I wanted to leave you with is just a little note from one of our congregate dining seniors, our congregate dining program we call Kupuna Wellness. So in her words, she says, "Please know that we truly appreciate the Kupuna Wellness program, and whoever created it deserves a raise. As a recent widow, this program has brought much needed joy. Exercise, socialization, and learning new things gives us hope, strength, and courage at our age. Mahalo for the experience." And so, like the others that came before me, we just ask for the continued support to be able to do what we're currently doing, and then to be able to expand and have the flexibility with our program to really meet the needs that are coming as our population continues to age and continues to need more support. Thank you.
Mahalo for that. We'll go into questions on the committee, but I'll first quickly go through, we'll turn to testimony. First with remote testimony, we don't have any registered, and I don't believe clerks have anyone online. We don't, so we'll go to in-person with no registered in-person. Anyone wanting to testify can come forward. Seeing none, we'll go ahead and close testimony. I'll go ahead and open it up to the committee if there are any questions. I did have a few, but Councilmember Tupola.
Thanks, Chair. Director Krukey, or he was here, right? Yes. Okay, yeah. Oh, Edward.
And both also acknowledging Deputy Directors present as well.
Whoever has the nicest aloha shirt, please come to the front. Thank you. Happy New Year, Director.
Happy New Year.
How are you?
Good.
Good. Just a few days ago, I got a call from DOH because, we're trying to work out different things for my community with homelessness, and they were shocked because they received about 4 times more than they thought they were going to get for the rural health bill. So about 190 million being released this year, and then every year it'll be more, right, up to about $1 billion. So specifically in regards to what you guys are putting out there, are there any proposals you guys are doing to try to seek some of this funding that has now been released to the state that really is for rural communities?
Yes, we saw that abundance amount of money that was awarded for rural. And we're looking at it in multiple areas, not just feeding medical care there's multiple categories. And yes, we are in conversations with the state.
Yeah, it'd be great. I mean, I know that their first tranche is probably going to go to, the main providers, YMCA, Kahuku Hospital, all the main guys that are in the rural areas. But if you guys have something solid, I think a proposal like some of the ones you're talking about that have longevity, they have statistics, they have impact. I would hope that we could garner some of that money for the rural areas of this island. And if you could, and if you're going for it, I mean, ask us as council members to write letters of support, of recommendation. I mean, that YMCA does it in my community. Let me write a letter of support. I can give calls to them because, once the money comes in, it's there. But I think it's whoever has the most credible and persistent voice. So I want that to be us. Let's have the most persistent voice.
I think those are excellent points. I look forward to working together on that.
Okay, sounds great. Thank you, Chair.
Councilmember Toba.
Thank you. I guess my biggest question is, we're having challenges on, it's not, whoever wants to answer it. We're having challenges on like getting good people to work and knowing that our population is growing in our age will be kapunas in the next couple of years. Are you guys getting the kind of help that you guys should be getting? Are people coming out and wanting to really help? At one time I did do Meals on Wheels, believe it or not, and I know that when I did deliver the meals, they really look forward to talking, start hanging out. But it's really hard to find because we have shortages in all the occupations. So are you guys seeing an uptick on young men and women wanting to provide help and service?
Council member, I think that's an insightful question and a layered and deeper, and you may even realize this, so you bring it up. Two-part, it's a complicated question, and I have a two-part answer for that, is that we still, within the aging network, have workforce challenges and struggles. So that's the easier of the part. But what I would say is that there is a shift in how we view Kupuna that may be connected to the cultural DNA of who we are as a community. So it's the challenge for all of us on how we see the care for Kupuna. Is it a blessing or is it a curse? Some see it both ways, yeah?
No, because we see different trades in schools now, right?
Yep.
And like really preparing
Yes.
the students for after high school and finding something that going, help them either get successful or like really be involved in the community. So, 80-something years of delivering food, are we seeing more and more people wanting to provide services to help?
Yeah, so you're right. There are now educational, more deliberate, intentional educational and career pathways in health and social services with a focus on kupuna. And that's the infrastructure side. Then I would say on the energy community side, there is kuleana responsibility for us to continue that energy. This is not just soft words. To truly be excited with the honor of celebrating and caring for kupuna. And that's happening already. It is a blessing to be able to support our kupuna, but it's our opportunity to make sure that we celebrate it and we promote it and we're visible in it. And there is a subtle shift in that.
I just want to know, what gaps remain, as kupuna population continues to grow.
Mm-hmm.
Because we see money coming in, but what gaps still remain? Because I look at the map and I know there's a lot more people that need to get outreach. We had a food sustainability informal a couple months ago, and out of the food really reaching the people that need the help.
Mm-hmm. Legitimate. That's a good question again. I think the easier one is the immediate, but also what we're seeing is elevated need, right? Which is, again, the growing kupuna population. That's the easier. We know that's a ship that has leaving the port. For the more immediate ones, I would say that maybe although especially on the federal funding side, right, is that it's hard to forecast what that might look like. For now, it's level funding. But what we are keeping our eyes on is knowing that a lot of federal agencies, including the ones that administer our funds, the infrastructure that is the organization has been dismantled. So literally, there are not people in those positions. There's no judgment in that. I'm just saying what is the reality. So even in level funding, then the question is what we've seen. Is there the staffing and mechanisms within federal government to disperse those monies into the community and what the timing of it is? I think that's where Director Krucky really challenges us, not just EAD, but the aging network infrastructure, that we double down on what we're good at, is that we legitimately have a robust partner and service infrastructure. It is robust, and we lean into the challenges. That's not just talk. We have the service and contractual infrastructure as well. So increasingly good, or I would say not even bad, good, as these emergencies come up, right, man-made or policy otherwise, whether it be natural or man-made, community is increasingly leaning into us to help them steer and strategize what's the best way to support. And they've been doubling down and leaning to us because we can provide that strategic discussions and feedback, but humbly say, we also do a good job in the implementation, like our partners said, yeah. So we don't just talk the talk, we walk the walk as well.
Appreciate that. Just a couple questions. And I'm just curious. I mean, it's clear, I think, from the discussion that the need isn't going to go away. It's going to just grow. I mean, the population of kupuna we have exists, and then the numbers, by what you said, 2040, I think is it 40% or 1 in 3? 1 in 3. And so, of course, I know every year you're going to probably be looking for funding for the needs, but I'm curious, so what is the source of the funding right now that comes through EAD? I don't know who'd be best to talk about that, but just curious kind of if you could walk us through what that funding source is, maybe how that compares to other counties and how they operate and scale. And that could be the providers too, because I know maybe you're working across the state. So I throw that out for whoever wants to answer.
Okay, so as LANAKILA Pacific mentioned already, there is the Medicaid population that supports a part of our kupuna populations, right? But those that are significantly income and asset constrained, their programs are not as robust or diverse as Elderly Affairs Division. For example, they do not have congregate meals programs. For EAD administered programs, it's split between Older Americans Act federal funds and kupuna care funds. Largely, kupuna care state funds are more intensive services, in-home services that you folks might be familiar with. Besides home-delivered meals, bathing services, adult daycare, et cetera, right? Remember, we talked about keeping kupuna in the homes and outside of facilities. Largely, that's kupuna care monies. Then we have federal Older Americans Act monies that largely support programs that keep kupuna in the community. Leanne mentioned some of those already, right? Our congregate meal sites, our health promotion, some of our transportation monies, legal services, yeah. But exclusively a split between federal and state monies. I would say of those federal and state monies, being that we have 3/4 of the kupuna population in the state, we receive approximately 3/4 of the total state and federal allocation of federal monies. Our other counties receive some county monies as well, but largely we do the best that we can to leverage the federal and state monies that we have, with our providers being aggressive in pursuing funding opportunities, whether it be philanthropic foundation, health plans, et cetera.
Okay, I appreciate that. And I'll open it up to if there's any thoughts on what type of funding or support would be helpful going forward. This is all for discussion, and so I throw it out to maybe the providers too, but what that could look like. And feel free to chime in if you have any ideas. I know we kind of touched on it, so I don't want to put anyone in an awkward space, but I think for me, I felt compelled to have this conversation. You know, we looked at the numbers, like Councilmember Tola mentioned a couple months ago, just saw the gravity of the situation. We know with the changes in SNAP eligibility, we're going to probably see more folks in need and not eligible because of the requirements and the restrictions. And then, of course, we have a growing Kupuna population. And understanding that city, state, federal need to work together, I think it's good for us to always be looking at gaps we can be filling and ways we can be supporting. Because I think at the end of the day, if our people aren't getting fed, I mean, that's everyone's responsibility, no matter what level of government. I saw Councilmember Tupola, your hand went up, so I'll throw it over to you too.
Yeah, no specific question, but I will make comment regarding just the area that I represent because we do integrate a lot with different food services. So on any given day in Waianae, somebody's giving out food everywhere, right? You see a line, probably it's for food. Every Saturday, every day. In fact, there's a handful of churches that have the full calendar, you know, of every church that gives out every place. So one of the conversations that I had with different churches in my community is, you know, how do we know that we're impacting the same people or different people, or how frequently? So the one model that I feel like is trackable is what they do at the pantry, right? So Janine, you know, she has an electronic database. When people order, it's on the database. She can track what zip codes they come from, which most of them come from my area, even though the pantry is in Kalihi. So they're coming out there and you get up to 10 items that you choose that you can get. And sometimes I asked her, like, does it kind of go down or is it the same 10 items? She said, sometimes it'll go down to 3. Sometimes people come and pick up 2 items because that's all they need. And I had that same conversation with Alicia at Waianae Coast Comprehensive Health Center because, you know, they do pre-pack boxes. So I wanted to know how much of the pre-pack boxes are getting wasted or how much of it is getting used, because wonderful when we give out poi, but not everybody like poi. So I get to see mailboxes around Waianae with all the leftover boxes scattered around. I get to clean homeless encampments and find tons of apples, tons of potatoes. And I see all the food scattered everywhere, which is not what we're looking for, you know. And then, you know, I have Arca Safety. That's one of our largest churches in Waianae. And they also want to kind of do a large scale food outreach. Paradise Chapel, they do every Thursday, 10 a.m. to 12. So at this point, you know, how can we collaborate or coordinate this, right? So similar to kind of what I did with like the HPD task force recently is basically we all sit down, we all have a concerted conversation about how we can conserve our resources and get towards one path. So I guess what I am trying to say is that I'm still in favor of convening it if we need to. I know everyone who does outreaches. I know everyone who has funding for it, you know, because Kahumana Farms has funding for it too. We do the, what is it called? The school boxes, you know, during the summer when they no more food. So I helped out with that as well, went out and passed out boxes. People just pull up, they drive in and they can pick up boxes. But my thing is that in all of our good efforts, there's a lot of waste. So how do we decrease the waste, increase the, you know, because these are great stories. These are impactful things that have happened for families. So I do think my suggestion moving forward is that in regards to just the Waianae area, right? Not necessarily Kapolei. I have different food basket areas in Kapolei that I work with, but in Waianae, it's easy. It's easy to figure out like what's where because we have huge homesteads. You know, we have individual community organizations. Almost everyone's connected to a church. So we have church communities that move around too. I guess would there be a favorability in us meeting and trying to coordinate it and see what's best? Because even though Waianae Coast Comp really is kind of the anchor of my community, it doesn't mean everybody feels comfortable going to their food pantry. It's true. Not everyone wants to go because they do service the people who go to their place first. They service a lot of people, but their grant is for Keiki and Kupuna. So where's the middle class, right? People ask me, okay, people who just having tough time, we don't really qualify. But of course, Waianae Coast Comp, they don't turn people away, so they'll help whoever. But then that's kind of, for me, where we get really smart at all of this is when we're targeting and we're very specific about the areas, the ages, who's getting, who's not. Because if all of my food outreaches are just getting the same 50 homeless people, then we're not really doing anything, right? We're just helping the same 50 homeless guys, which is fine. But I think if we're trying to measure the impact, we can't just measure it with one organization, cannot just measure it with YMCA, can't measure it with just Waianako's Comp. We're going to have to try to see if we can measure it across. And I have 13,000 people in Waianae. I know that sounds like a lot, but it's not a big number. We could actually see exactly what number of people in need we have, how many are kupuna, how many use Waianako's Comp, how many don't. So how does the YMCA play into that? So would you guys be in favor of kind of assimilating that data with me?
Councilmember, those are really excellent points. And I think that we're growing into never giving out this much food before ever. I mean,
Right.
we are really pushing it because the needs are so great, the timing is great. And so as the volume increases, to your point, then the ability to understand what's going on, manage it somewhat, direct it, so it's most effective, those are all excellent points. I don't have something in place right now that does that, but that's worthy of continued conversation and oversight into that area. We do have pockets of information, so maybe we can pull some of those together and start to get a view of that. But I think it's a natural piece for you to have that conversation that you had, because we're pushing out so much, and with that you see waste, and the waste is what you want to stay away from. So those are just excellent points.
I'll convene the meeting. I've had multiple conversations with Janine about how we bring a more electronic system into the coast, because that's the only way we're going to actually be able to track instead of just, papers. I know for Waianako's Comp, they kind of fill out papers of who came, what their age is. So I will convene the meeting. I'll send out the email and let's see what we can do, because I feel like we can make progress if we get a little bit more geographic, we get a little bit more specific, we stay data oriented, and that way it doesn't feel so overwhelming, right? Because I think the whole issue itself is very overwhelming. Let's just take it community by community and see how it goes. So I'll send that out to you, and thank you to all of you guys for all that you do. Really appreciate it. Thank you, Chair.
Of course. Thank you for your feedback. Councilmember Dos Santos Tam, did you have any questions? Perfect. Well, I wanted to say mahalo for all the work that you're doing every day. I echo those sentiments from Councilmember Tupola. Went to the Key Project Kupuna Breakfast. I'm with Rainbow Seniors quarterly. They rotate through us in Wahiwa. And I think at the end of the day, our budget as a government reflects our values. And at the end of the day, I think we're only as good as, the least well off amongst us and how we're taking care of them. And just knowing the kupuna in my life, and I know we all have kupuna in each other's lives, that, we want them to be able to age in place with dignity and have a quality of life that I think all of us deserve. And so just so grateful for all the work that you're doing. Seeing no other questions from the committee and no discussion, members, we are adjourned. Mahalo.